شهر رمضان الذي أنزل فيه القرآن هدى للناس وبينات من الهدى والفرقان فمن شهد منكم الشهر فليصم ومن كان مريضا أو على سفر.
In this episode, we shall be rounding up on our discourse on health security, ensuring health security in the society. We started off by defining health, the WHO definition of health. We also looked at the Islamic perspective on well-being, on health. We mentioned that in the Islamic perspective, there is a spiritual dimension to well-being. Then, having defined health, we went on to look at security, health security. We defined health security as a way of the activities that will help to safeguard public health, and this can span across boundaries. So this health security is simply a way of preparing the society against health hazards. Then, having defined health security, we mentioned 4 types. We said one of them is the biosecurity, which has to do with looking at sources, animals and plant sources. Those are sources of infections, sources of threats to health security, and nipping them in the bud. We talked about national security. We mentioned global health security, and then human security. And looking at all of them, basically what they focus on in how do you protect the public against the major hazards to our health. Then having mentioned that, we went further to look at the threats. What are the threats to health security? And we mentioned that there were 2 major threats to health security. We said infectious diseases like tuberculosis, like HIV, and what have you. Some of these are the post-threat because a single infection can wipe out a whole nation. A single disease infection, if it is very potent, if it's not taken care of on time, can wipe out a whole nation. So we also mentioned other threats. We mentioned, apart from infections, we mentioned pandemics. We are currently experiencing a pandemic, like we mentioned in the last episode, that is the COVID-19 pandemic. And we said this is also a major threat to health security. Then we mentioned other threats like natural disasters, conflicts, and what have you, that these are threats to health security. Then we now went further to talk about the requirements for health security. We said preparedness is very important. Having a good workforce is also very important. People that are well trained in the fields of epidemiology. Then we talked about immunization, vaccination. That is very key when you're talking about health security, specifically pandemics. You must be prepared. You must have potent vaccines that will protect the people against these health hazards. So now we'll continue on some of the requirements before we then summarize. So the other one is what we call antimicrobial resistance. We must have a team that will contain, it will be able to predict and contain antimicrobial resistance. What do we mean by antimicrobial resistance? Simply put, antimicrobial resistance is simply a condition in which the body is no longer able to respond to antibiotics. And this usually stems from misuse of antibiotics. People misuse antibiotics a lot. So rather than taking the prescribed doses, people tend to take just very few of the doses. For example, you are supposed to take an antibiotic for 5 days or 7 days. You end up taking the antibiotics for just 1 day or 2 days. Why? Because you are okay, you are feeling better. And so you don't complete the dose. So what eventually happens would be potentially resistance to these particular drugs in future. So when you now have several people developing resistance to antimicrobials, then you have what you call antimicrobial resistance. And this could actually get to very escalating levels, whereby you have in the population, majority of the population developing antimicrobial resistance. This becomes a key problem. You now have to start looking for alternatives. You have to start looking for new drugs or new antibiotics to cater for that problem. And if you don't get, that infection can wipe out that community. So that is why antimicrobial resistance is very key to guaranteeing or to ensuring health security for our people. Again, we have what we call real-time surveillance. The surveillance is simply ensuring that you are monitoring and checking for very potential disease conditions. So you are always, it's similar to preparedness. You're always monitoring and ensuring that you are reporting any suspicious disease events, and you are following it up with people that are skilled, that have the requisite skills. Then again, we have what we call risk communication. Now, risk communication is very, very important, and it's simply a way of communicating risk. That is, you are educating the community, the people, about the various risks that are present. For example, during the COVID-19 situation, you have a lot of posters, a lot of jingles, radio jingles, and television adverts telling us about how we can protect ourselves against the COVID-19 disease. Things like social distancing, how to maintain social distances, how to ensure you wear your mask appropriately, that is the nose mask appropriately, ensuring that you wash your hands. All of these are risk communications, which the people must understand so that they can protect themselves. So if you communicate risk on time and you do it consistently, then you are empowering the people and you are guaranteeing their health security. So risk communication is very, very key, in guaranteeing health security of our people. Then again, the points of entry, ensuring that those points of entry in a particular country are manned by trained personnel. So anybody entering the country must be skillful, anybody entering the country must be well screened by the personnel that are at that point of entry, so that if he has, perchance, any of these infectious diseases, then is quarantined and taken care of. So these are requirements for guaranteeing health security. So in summary, we have been looking at ensuring health security in our society. We started by defining health, looking at the Orthodox perspective and the Islamic perspective. We went on to look at what is health security in itself, the WHO definition, then look at the various threats to health security, and then what are the programs and the requirements for health security. And we find out that we also mentioned that to guarantee the health security of a society, the responsibility lies on the government, the leaders. They have that responsibility to ensure that the safety, the health of the people is guaranteed. The security, their health security is guaranteed. Now, if this is done, then we have a huge benefit in terms of manpower, in terms of productivity, in terms of economy. Then there will be development, there will be national development, there will be progress in the country when you guarantee the health of our people, the safety of our people, the health of our people. Now, we've looked at COVID-19 as an example, and you realize that all the various strategies, all the various things that are being put in place by the government with regards to our health as per COVID-19, they are all geared, they are geared towards protecting us. How did it start? It started by the communication, ensuring that we protect ourselves, we use the face mask. Then the lockdown came up. Everybody had to be at home for a period of time. This was to protect us from the threat of the pandemic so that it doesn't worsen our situation. A few people were already being hospitalized. Some people were dying already. But we had to take that step of complete lockdown Nobody had to go anywhere. And we could see that this lockdown actually prevented the spread of the disease. So that is one of the ways by which we could guarantee the security of the health security of our people. Then after the lockdown, we now had continuous communication from the government on various ways by which we can protect ourselves: social distancing, washing of hands, using of the nose mask, avoiding overcrowding. And we could see that there were strict rules, strict instructions. For example, the places of worship must not be crowded. There's a maximum number of people that can go to the mosque or the church or places of worship, so that this can reduce the risk of contracting the disease. Then there were other measures that were put in place too. Marketplaces were supposed to be safeguarded. They were not to be visited, at certain times. Even the curfew was maintained. Then we had other places like bars and restaurants, cinemas. All of these were shut down. And the aim is to reduce the possibility of spread of the infection. So these measures are measures of guaranteeing health security of our people. Then we now went on to prophylaxis or vaccination, looking at vaccines that will protect us against the disease. And alhamdulillah, like I mentioned in the previous episode, we have very effective, potent vaccines that can protect us, and they're also safe. Because again, if you have vaccines that are not safe, then there's a problem. You are further worsening the situation in the country. But if you have vaccines that are safe, what do we mean by safe? Safe based on the regulations by the WHO and by the national regulatory authority of that country. So once the national regulatory authority, for example, in Nigeria, our national regulatory authority is NAFDAC. So they must guarantee the safety of the vaccines. And they have been able to issue a statement on the safety of the vaccines. The same thing with other well-meaning associations. For example, the Islamic Medical Association of Nigeria also has issued a position statement stating the safety of the vaccine, in addition to several other statements on COVID-19. So once we can guarantee the safety of these vaccines, then it becomes very important to protect the people and administer these vaccines to our people. Now, talking about the vaccines and the safety of vaccines, the vaccines are just like drugs too. All drugs have their side effects. So you cannot expect a vaccine that is 100% free from side effects. We are going to be experiencing some minor side effects like body pain or pain at the injection sites for a few days. These are normal side effects that we will be encountering. Even we may have fever as a side effect. So these are normal side effects which we even encounter when we take some of other drugs apart from vaccines. So there's no drug that is 100% free of side effects. While some people may experience side effects, some may not even experience any side effects from the vaccines. And that is what we are actually encountering. Some people have side effects, some have no side effect at all. Now, there will be a very, very few set of the people that will have some serious side effects. And this is what we've had in the global scene, whereby some people develop some blood clots as a result of administration of the vaccines. So this is expected. Like we said, there will be minor side effects, which are common. There will be no side effect at all in majority of the people. Then you will have very, very few, which we call rare side effects, which we'll have in some people. So we cannot rule that one out. And because we have a few people that are experiencing blood clots, does not now mean that we should now stop the vaccines. You must ensure that you continue and everybody is safe. The vaccines are very, very important. They are safe. And so far, from the data that we have, both nationally and globally, the vaccines are still safe. Remember, we mentioned that safety means free from serious side effects. While we have some people that do not exhibit any symptom, any side effect, some have minor side effects, while some, very, very few, have severe side effects. And those few that have severe side effects, some of them may have some original health problems, which might aggravate the effect of the vaccines. So we enjoin all of us to continue to help the government by going for the vaccinations so that we can guarantee our health security. So in summary, we have been looking at ways of ensuring the health security in our society. And we all have a role to play in ensuring the health security of the government. Firstly, we have to understand what are the various threats to our health security. And we've mentioned this severally to us. Threats of pandemics, threats of infectious diseases, irrational use of drugs, even our lifestyle, not having a healthy lifestyle, can be a threat to health security. Imagine somebody who is abusing drugs. Imagine somebody who is eating irrationally, not taking the necessary precaution, ensuring the food hygiene, and what have you. So all of these are potential threats to our health security. So we have a role, you have a role to play in ensuring that we assist the government in providing health security to our people. So I want to say that all in all, we want to appreciate everyone for your attention, for listening, and we pray that the little that we've had will benefit us maximally in guaranteeing the security of our health, in assisting the government in ensuring health security for ourselves and for the majority of our citizens. With this, I say, Assalamu alaikum wa rahmatullahi wa barakatuh.